friends, I'm Dr. Arti Thangudu, an endocrinologist and lifestyle medicine doctor and founder of Complete Medicine, where I help high-achieving people take control of their health and feel their best. Today we're talking about something I want everyone to know: how to negotiate your medical bills. Most people don't realize that medical bills are often wrong. You could be paying for things that you didn't even receive, like a medicine that you didn't take, or a test that you never had, or a surgery that you never had. In this video, I'm going to walk you through the most important first step when you get a medical bill, how to find out what a fair price really is, and how to negotiate your bill to save money, sometimes by even more than 60%. So let's get into it. Understanding your bill when you get a medical bill in the mail is so important. You might get just one big total, like $4,000 for services, but that doesn't actually tell you what you're really paying for. So the first thing that you should always do is so important, and that is to ask for an itemized invoice. That means a list that shows every single thing that you were charged for. You'll see items like the Tylenol you took, the CT scan you had, the surgery that you had, the anesthesia fee, the surgeon's fee, kind of like a receipt at a restaurant. So you expect to see every single thing that you paid for, so you know that it's accurate. Similarly, you should be doing the same thing for your medical bills. Even the cost for the lab that they looked at your blood or your tissue, that's called pathology, that should all be on the itemized invoice. And each of these things will have its own line and price next to it. And it will also usually have a code next to it. So once you have this list, look really carefully. Did you actually receive everything that was listed? And you'd be really surprised. Medical bills are often wrong. So you might find a charge for a medicine that you never took, or a test that was ordered but never done. So if you see something off, call the billing department right away and tell them kindly but firmly that that item needs to be removed. This actually takes a lot of patience, and you might need to call multiple times. And then once you've double checked your bill, the next step is to find out what you should have been charged. A lot of people, most people, don't know how much different medical services should cost. So this is a really important next step. So go to cms.gov. That's the official website for Medicare, and there you can look up something called the physician fee schedule, and you can also look up CPT codes for things that you might have been billed for. And so then you can also ask the hospital or medical practice the CPT codes for what you have if that itemized bill doesn't have it. So then you'll look up that code, you'll see what the what Medicare allows for that service. And if you're not in Medicare, you can expect the price to be sometimes like twice as much as what Medicare might have billed. And we'll get into why later. But sometimes it's outlandish, like 10 times, 50 times what Medicare would allow. And that is where you can negotiate and say, hey, this is what the Medicare price was. I know what I'm talking about. Bring down that cost. So that gets us to the next step, which is negotiating. So if you have a really high bill, call the hospital's billing office and say something like, I'd like to pay this bill in full, but it's really high. I can't cover it today. Can I get a discount if I pay it in full today? And sometimes they'll just knock off 20-30% right away, right there, which is crazy, I know. And then just say, thank you, is that the best you can do? And you'll be amazed that oftentimes they'll take off way more. I've seen people get like 65% reductions in their bills simply by asking. And this is for a couple reasons. One, they overprice it for everything. Two, hospitals would much rather you pay a portion of your bill than not pay at all. And then they have to send it to creditors to get possibly pennies on the dollar. And also getting it sent to creditors can hurt your own credit score. So you don't want that to happen either. So before we wrap up, there's one more tip. If you want to avoid these surprise bills altogether, try using a direct care provider. Direct care doctors often have transparent upfront prices for labs, imaging, visits, and you'll know the cost of your labs before you ever walk in and have it done. And oftentimes you'd pay way less than you would for traditional insurance. The same is true for imaging studies and testing. And so if this video helped you, please hit the like button, share, subscribe to my channel, and help me get this word out to more people so that they can really take control of their health and not be afraid of what they might have to spend on their medical bills. This can be so empowering and save so much money. It has personally saved me thousands and thousands of dollars on my own medical bills. And if you haven't yet, please listen to our podcast, Endocrine Matters, and you can follow me on Instagram, just my name, at Dr. Arti Thangudu. Every like, share, subscribe, and follow makes a big difference in getting the word out. Thanks so much, you guys. See you next time.